introduce yourself and tell us what do you do and what's the role of a lobbyist in FMHCA?
Hi, I'm Corinne Mixon. I am, as mentioned, the lobbyist or one of the lobbyists for the Florida Mental Health Counselors Association. Specifically, I work with Mixon and Associates, and we represent the Mental Health Counselors Association's statewide legislative interests in Tallahassee. So what that means is that on an annual basis, we help develop and process legislation through legislative committees and ultimately through the legislative session. And conversely, there are times when we help fight legislation that it would have an adverse effect on mental health counselors in the state of Florida. That balloons at times. We have bigger topics that we look at, like statewide budgets and mental health care as it relates to insurance. So those are our primary interests in Tallahassee. We do specialize in representing associations like FMHCA, so we know that it's our job as lobbyists to represent an organization of practitioners versus a small group of people or a large corporate entity, and as such, we also spend a lot of time communicating with the membership what our goals and what the setbacks are in Tallahassee, and we certainly welcome that communication from the people of the Florida Mental Health Counselors Association.
Thank you. And so when you say, well, there are two ways at least in which we help, can you give us examples from past successes of each one of those ways?
Sure. So we can look at issues like the development of people that can be used by the court system to review cases of competency to stand trial. A number of years ago, it was brought to our attention as your lobbyist that we had an issue with courts not using mental health counselors or not permitting mental health counselors to be involved in competency cases. And of course, we don't have enough psychologists out there and psychiatrists out there to make those determinations for the courts. In instances like that, we had to come in and lobby the legislature to ensure that mental health counselors can be accessible to the statewide population and not just in independent private practice settings. And then each year when the governor releases a budget, your lobbyists at Mixon and Associates, as well as the lobbyists representing other healthcare practitioner groups, go ahead and take a look at that budget to make sure that it's not cutting programs specifically related to mental health entities. Now, that can be government-funded types of programs through the Department of Children and Families, or it can be looking at substance abuse treatment in children and families. But what we need to do is just get back together with the folks that run the budget each year and make sure that they're not cutting that funding. And thankfully, the legislature has not been too tough on those issues over the past couple of years, and we've been able to be at least somewhat effective. We hope that continues as the state starts to look at mental health care as part of primary care and as part of health care in general.
Thank you. And what are current issues that we are dealing with? What is on the agenda?
So the primary issue is one that may be a little bit difficult to understand, that in Florida, folks can register as interns. It's a very useful way to get experience and work under a qualified supervisor. The problem is, and I'm certainly not picking on interns, but that we have an issue with people re-registering time after time. And in some cases, we have individuals who have been essentially participating like they were running an independent private practice and as interns, and they've been doing that in some cases even after failing the national exam 21 times.
21
and
times?
21 times we have a practitioner, and the board has no authority, the 491 board, which governs clinical social workers, mental health counselors, and marriage and family therapists. They have no authority to allow that person to disallow that person from re-registering, and so they have to issue an additional intern registration. I was shocked to find the numbers recently that there are 170 individuals that are registered interns in the state of Florida that have been registered interns since the inception of the law in 1998. There are 1,300 individuals that have been practicing as interns beyond that 5-year term. And so what this bill does is, although it grandfathers in individuals that are currently interns and want to become interns before July of this year, it grandfathers them in for 5 years. However, it says after that, you can't re-register as an intern unless the board finds a special exception for you based on, say, military service.
Thank you so much. Is there anything else that I should have asked you and I haven't, or anything else that you would like to add?
Well, I do want to follow up because I think it's important that FMHCA represents not only fully licensed practitioners, but also the internships that make up your membership and make up an important part of the healthcare community, that the reason we're taking a look at that topic this year is because 35% of the discipline cases that come before the regulatory board do involve interns that have been practicing for over that 5-year term. So I think it's important that FMHCA represents both fully licensed practitioners and the interns, but understanding that it will move the profession forward and put you on an equitable level with other mental health professions to make sure and take care of those bad actors that are getting into trouble, ultimately costing 35% of those discipline cases and costing the state money. And other than that, I just want to offer myself as a resource to this association and tell you that we're proud to represent your very important industry in Tallahassee.
Thank you so much.
Thank you.